So here's a quick summary about the last assignment. I chose language barrier as the essay topic, and in my case, it was a 34-year-old Greece woman who only spoke Greek. The patient understood a couple of words in English, but not enough to have a full-blown conversation in English. So she had sprained her ankle hiking in the woods, and she called the ambulance, and the ambulance brought her to the ER. And because of the language barrier, they weren't really able to assess the pain level or understand the type of pain the patient was feeling. Nurses had to opt for a translator app because the translators had got off from work. Although the translator app wasn't perfect, but it worked well enough for both parties to communicate between each other. Then I'll be answering some of the questions. So yes, I have come across similar situations. Actually, this situation was from a personal experience, and then I usually come across language barriers, or have come across language barriers and cultural differences. The situation I described is pretty usual, and especially when the translators are off from work. Most nurses opt for the translator app, and of course we don't put in like sensitive information. It's usually just to ask some simple questions. If I was in a patient's situation, I would probably feel good because the nurses took like the next initiative to make sure that the patient understood what was going on and tried to find like some type of middle ground of understanding each other. I feel like the patient could feel some type of frustration, and I feel like the frustration could rub off on the nurses and kind of like make the working environment kind of not necessarily hostile, but it could maybe change the way the nurses go about things. I feel like I am pretty prepared. Of course, there's always room for improvement, but for myself, I try not to assume stuff. I would rather ask the patient instead of assuming. So I feel like that minimizes a lot of miscommunication, misunderstanding, and just thinking for others, right? Yeah. For me, the biggest challenges I have is like having a language barrier and having to comfort a patient. I mean, at times you don't need to say much, but I feel like it could also help the situation when you're able to say something to comfort the patient, or when a patient gets very hot-tempered, but because of the language barrier, it's hard to explain what's going on, what we are doing, because we don't have a translator 24/7 by our side. So yeah.